One last thing I'd really like to talk about. First of all, it's really important to know that our hospitals are very safe to be right now. I think people are scared. You know, hospitals have very strict guidelines of infection control going on, and when they're taking care of coronavirus patients, that's often being done in a special area in the hospital. But I know that people have been a little bit afraid to go to the hospital just for routine things or go to the ER, and I just really don't want anyone getting sick from something else or, God forbid, dying from something that they could have gone to the hospital for. So please know that there are really great infection, probably better than ever, infection control going on in a lot of places, from nursing homes to hospitals. But I want to talk about the providers for a second. I read a very sad story today about an ER doc in New York City. She had been in the thick of things, treating coronavirus patients nonstop, and unfortunately took her own life. She wasn't someone who had struggled with depression or anything, at least in the story from her family. But, you know, for healthcare workers out there, all of us aren't seeing what you're seeing. And sometimes as we move on and you see us trying to sort of bring our life back, I know that there are many of you who are fighting the battle, you know, on the front lines every day, whether you're a first responder or a healthcare worker, or you're a nursing home worker, or you're one of the folks working in our prisons. And it can come up on you. I just want to say, you know, when I was young in my career, I started out in New York City in the Bronx. So it was the middle of the crack cocaine epidemic, and people were dying. It was a very, very rough time in New York, not unlike here, where half of my kids were going to be dead by the age of 3 from contracting AIDS in utero. And there were just rooms full of babies with no parents and incubators with no parents. And day after day I worked there, and I didn't notice, like slowly, week by week, I lost weight. Before I knew it, I had lost 25 pounds. And I was starting to feel anxious. I didn't know I was feeling anxious because I would run up and down the stairs from the emergency room, and the more I ran, I'd get rid of that anxious feeling. But when I would sit still or I would go home at night, I found I couldn't sleep. And I started to have panic attacks, which is something I had never had in my life. I'd been through a lot as a kid. But I think seeing other people suffer and die, that I felt like I couldn't help them, that helpless feeling caused that for me, and I sought help. And I just really want to say to everyone out there, please seek help if you're struggling at all. Don't be afraid to. It's nothing we need to be ashamed of. And we do have our text for Hope line. It is 741-741. Text for Hope, 741-741, and you're not alone. And just reach out. We're not forgetting about you. As we talk about getting out and about, we're still thinking about you. Thank you.